Well, guys, welcome to this nerd review, which is today just going to be about gastrointestinal bleeding. First of all, what is the basic concept of gas? So yes, the basic concept of gastrointestinal bleeding is that we can get bleeding from either the upper part of the gastrointestinal tract or the lower part. So what does any of this mean? So basically, if you look here, gastrointestinal bleeding is any sort of bleeding which starts from the GIT, any sort of bleeding. So anywhere in the gastrointestinal tract. So what is the definition of gastrointestinal tract? That's anywhere from the mouth to the anus. Basically, if the food that we take is going to be absorbed, and this is going to be it's going to be taken in the mouth, and then you're going to be extracting the nutrients, and you're going to be utilizing that as energy. So anything which occurs from this tract, from the mouth, any bleeding that occurs from here, from this place, this is going to be classified as gastrointestinal bleeding. And guys, what is the type or the degree of GIT bleeding? The type of GIT bleeding can be occult, and the degree can be from undetectable to like acute, or it can be even further or more to like life-threatening if that is massive. So massive or life-threatening bleeding. So guys, how is the bleeding divided? So like I said, the bleeding can be divided to upper GIT bleeding, lower GIT bleeding. Upper GIT bleeding is much more common, so it's 90%. But what are the parameters of this? So the parameters are essentially like from the anywhere from the mouth up until your duodenum junction, and that is about 90% of the incidences. So if you look over here, I have this diagram over here, and basically this diagram so this diagram over here, also in the source of this photo is from this blogspot.com. Anyways, any type of bleeding that occurs from the mouth all the way until this junction which I've drawn over here, and this junction is going to be otherwise known as the gastric duodenal junction. And this junction over here is where the duodenum starts and the duodenum ends and the duodenum starts. And here's a much more zoomed in photo over here that allow me to put this into this section. So like I said, this is the part of the duodenum flexure. So I believe so, and essentially any sort of bleeding from the mouth, esophagus, stomach up till this place is known as upper GI bleeding, and anything from this point over here, this point over here and lower is known as the duodenum junction to the anus, and that includes, so that is about 10% of the bleedings. So just to give you guys a bit of a review of what is even going on in this photo, upper GI bleeding occurs from mouth all the way to duodenum junction 90% of the time. Lower GIT bleeding from the duodenum junction until the including the small large bowel up to the anus is 10% of the time. Now guys, what is the causes of the gastrointestinal bleeding? So guys, here's a great mnemonic which you guys should really drill in your mind, and that is GIT bleeding. So G stands for gastric ulcer, and I'm going to be going to the details as to the pathophysiology of each single option and why it causes GIT bleeding. So gastric ulcer, they can be ileus, can be there. They can be the would be the T would be from medullary vice tear. That's kind of a stretch. And then the B can be bloody diarrhea or bloody dysentery. There can be L, which is portal hypertension gastropathy. E is esophagitis. E can also be some sort of like esophageal varices. D can be erosions. I can be intestinal like vasculitis, intestinal carcinoma, cancers. And we can obviously have gastric ulcers, which I've already mentioned previously. Guys, now let me dive into the details exactly of this. What is this? It looks like a very overwhelming slide, so let me just break it down for you guys. So first of all, we'll just start with the stomach ulcer. So why is there bleeding from the stomach ulcer? Well, 70% of the time, stomach ulcers are due to the fact that there is some sort of H. pylori infection, but there can be other reasons such as non-steroid anti-inflammatory drugs and bad reflux. And what happens is ulcers, they can occur in lesser curvature. So what does any of that mean? If you look over here, okay, one second. So yeah guys, anyways, if we can just zoom into this diagram, and over here if we see this the stomach over here. Anything over the lesser curvature is where the gastric over here would be where the gastric ulcer would essentially be occurring. And if you look over here, the lesser curvature causes the bleeding. And why is there bleeding to be occurring? Well, there usually is some sort of left gastric artery which is running down here, and that is the cause of the bleeding. Guys, there can be other things such as ileus. Ileus can be usually due to some sort of surgical things, maybe due to electrolyte imbalances, and this is going to be due to the disruption of the normal pushing and pulling movement, the propulsive movement of the intestine. This is very, very important that ileus is the blockage of this, and that is due to some sort of malfunction paralysis. The problem can be obstruction. It can be due to spinal cord injury. Usually the spinal cord injury can be from the vertebral thoracic vertebral number 5, and this is going to cause hypomobility and within the bowel and hypothyroidism. Another cause of ileus can be due to injuries of the injury. This probably is the most important cause, so that's why I'm going to put it in bold and underline it. Is that another cause of injury is due to the injury to the arteries that are supplying the GIT. So when those would re-rupture, that would cause some sort of bleeding to occur. You guys, now I want to talk a bit more about the medullary vice tear. Medullary vice tear is like a laceration or a tear, which is going to be occurring in the esophagus. So if you zoom in over here, imagine if there's a tear over here, some sort of tear going inwards into this wall over here. That would be otherwise called as medullary vice tear. The laceration is deep cut in the duodenum esophageal junction, and this caused due to alcoholism, to bulimia, and this laceration can bleed, and it can cause hematemesis. Other causes can be, obviously, this can be GIT, and the B would be bloody dysentery or bloody diarrhea, very, very straightforward. So, for example, Shigella or E. coli can cause this sort of problems. We can have the L, which is the portal hypertension gastropathy, and that can also cause bleeding due to the fact that, one second, there can be changes in the mucosa due to portal hypertension, and this is one of the causes of liver cirrhosis. And this change in mucosa can include friability in the mucosa, and this can cause dilation in the blood vessels at the surface. So if you're getting any sort of portal hypertension, or you're getting damage to the mucosa, and then mucosa can therefore cause bleeding. Now let's continue. Like I said, the GIT, B, L, and E will always be esophagitis, and esophagitis can essentially just cause inflammation in this esophagus, and then what happens is stomach acid starts to back up in the esophagus, which may lead to bleeding. And and the source for this, which I got from, was very well health. By the way, I didn't mention that the source I got these things from was from Pathoma, and over here my sources, Wikipedia. I think also Pathoma was my source over here, and I think probably this one was Wikipedia or something like that. I'm not sure. Over here again, there's some sort of inflammation. E is going to be obviously our erosive esophageal varices. Basically, the distal esophageal veins, they get congested. This is due to the fact that there is going to be gastric vein is going to be. I need to get the diagram for this. Gastric vein, you can imagine it running around this time. It's going to be drained to the portal vein, and there can be risk of rupture, and this can cause some sort of painless hematemesis. So look, what happens is that the esophageal veins, they drain into the gastric veins. The gastric veins drain into portal veins, and portal veins then go to the liver, and then liver they go back to the heart. So if there is going to be back of the blood in the if there's going to be esophageal varices, they can back up blood all the way over here, and this what happened would cause very painful hematemesis, and obviously maybe due to portal hypertension, you may have some sort of liver cirrhosis. When your liver is on function, you're not producing enough coagulation factors, and that can also contribute to this. So like I said, GITBLEE, and then D would always be our duodenal ulcer. And duodenal ulcer, like it's very similar to the the gastric ulcer, and that is due to the fact that it's caused by H. pylori. But over here, you must remember that duodenal ulcers are much more common. They are 95% of the time caused by duodenal ulcers, and very rarely they're caused by this thing called Zollinger-Ellison syndrome, and this is due to the fact that gastronoma. So you're getting more gastric secretion. More gastric secretion means more acid secretion. The acid hits the parietal cells, so you can imagine you're getting a gastronoma in your pancreas over here, and the gastronoma would go and hit the parietal cells over here, and that would cause you to secrete more acids, and that acid could lead to a massive amount of secretion of acid, and that could lead to some sort of bleeding from the gastric duodenal artery and probably running over along here. In addition to that, like I said, GITBLED I can be intestinal carcinoma vasculitis. And in fact, the intestinal cancer, the main or the only symptom that we're going to be seeing is going to be bleeding, and that's the main thing about that, which can be lower GIT bleeding. And obviously gastric ulcer, the same thing apply. I will explain this one. But guys, what is acute massive bleeding? Guys, the main hint word over here is massive. Massive is really important because that will give you idea that this can cause a lot of bleeding, and if this goes more than 20%, this can in fact lead to shock. Shock is a key word to say this. And there are different types of shock. There's distributive shock, there's neurogenic shock, there's anaphylactic shock, there's hemovolemic shock, and this one is called hemovolemic shock. And this can occur within several hours, and it is going to be, so your patient will present with shock symptoms. So you'll be wondering that usually shock, hypovolemic shock at least, can be caused by some sort of bleeding, some sort of dehydration, some sort of bleeding, dehydration, some sort of capillary leakage syndrome, or you're getting edemas. But over here, the thing is that you're getting some sort of bleeding which is occurring in the GIT, which you've lost 20% of the blood from the blood vessels, and that has occurred over several hours, and that can lead to hypovolemic shock, and you're going to have shock symptoms. Shock has many symptoms. Like there are many symptoms of shock, but one of them can be cold, pale skin because you're trying to vasoconstrict, and that's one of the main things. And you can also have rapid bleeding because your lack of O2, and you may have dizziness. You may even faint eventually. You can have chronic or occult or magical bleeding. This type of bleeding is due to the fact that there can be some sort of bleeding within the stool itself, and this type of magical occult bleeding, it is there for a very long time. And one of the main things that I want to drill is that it can cause anemia. So the main thing I want to drill is that it can cause anemia, cytopenic anemia, and this can even, if it's an elderly patient, can possibly indicate that there can be colorectal carcinoma. So there is no macroscopic evidence. So if you looked at examine the stool macroscopically, you would see no really much amount of blood. And this can be due to the fact that there can be cytopenic anemia. If there's so much bleeding from the stool, so much chronic occult magical bleeding, so the keyword here is chronic, it can eventually lead to anemia. And this can cause a cytopenic anemia, which can and because you're in cytopenic anemia or hypochromic microcytic anemia. Hypochromic means less hemoglobin, microcytic means small of size of the cell. Anemia is due to the fact you have excessive amount of loss, you have deficient, or you're not taking inside enough iron in your diet, or you have poor amount of, you might have some sort of gastritis, so you can't absorb, or maybe you're a pregnant woman, so your children really require iron, or your young child really requires iron for growth. And the diagnosis should be done very early, and you must check biochemical stool test for hemoglobin in the stool. So guys, there are three main signs and symptoms which I really want to talk about, which is melena, which is the blood in the stool. There can be the hematemesis, which is blood in the vomit, and there can be intestinal hemorrhage. So let's dive into it. Like I said, there's could be a lot of classifications, so I'm going to dive into it. The hematemesis first of all. Like I said, hematemesis is you vomiting the blood, and it can be divided into non-digested fresh blood, or they can be digested blood over here. And that digested blood is digested obviously by HCl. Non-digested blood is going to be a very light color blood. We're going to talk about this. So like I said, the main problems, like I was saying, that the main problems over here is going to be due to some sort of esophageal problems. Like I said over here, I explained esophageal varices. Esophageal varices, for that, if you want to talk about it a bit more, again, we can just drag in the photo over here. Basically, you're getting congestion, and that is due to the fact that your esophageal veins, they drain into your gastric veins, they drain into your portal veins, and due to that fact, there can be problems, or due to the fact that there may be liver cirrhosis, and liver cirrhosis can be due to the fact that there may be low amount of coagulation factors, so you may be getting bleeding over there. Miliary tears, like I said, if you just zoom into this photo, just imagine taking like some knife and you're kind of like stabbing this, or you're making tears, you're making lacerations on this wall of the esophagus. And you can obviously get, and there are many complications of gastric ulcers, and one of the complications of gastric ulcers, they can be perforation, so you can kind of like, you can just perforate through the mucosa. The diagnosis of this, so yeah, hematemesis in general, not only non-digested blood, it has to be differentiated from hemoptysis or epistaxis. That's the main thing you need to differentiate it from, and that is going to be expirated blood from the hemoptysis is basically blood that is come from your lungs. So you can get hematemesis, for example, in good partial syndrome, or you can get epistaxis from just some sort of problem in the blood, in the nose, sorry. And the expirated blood from the lungs, from the epistaxis, bleeding from the nose, this can be swallowed in the, so basically, yeah, bleeding from the lungs and nose. Whereas hematemesis, and what happens is that this sort of hematemesis or epistaxis can be swallowed and be vomited in the morning. That's the main thing. Now, digestive blood can be from the HCl, which is going to be produced by our obviously our parietal cells, which is triggered by gastrin.